Hello, ladies and gentlemen. I am pleased to welcome you to the 400th episode of Newsflash. Ladies and gentlemen, it's an absolute pleasure to be doing this with you. This isn't quite the 400th episode that we've originally had planned, but don't worry, that planned 400th episode will still come very soon. So, yeah, that's going to be later this week. We'll have a bunch of fun guests on, having a fun show. But, trust me, this is going to be around a half hour today. But that does not mean we don't have a very, very fun show planned for you today. Crazy story. Trump is now self-medicating with hydrochloroquine, the new drug. Also, we're going to talk about how the government is reaching a $354 million deal with a new company to make drug ingredients in the U.S. Alex Azar continues the Trump administration's beef with the WHO. We'll be talking about that. And also, Senator Ben Sasse's crazy graduation speech that he released publicly. And, you know this one's going to be good. Dana White rates some videos of Sean Hannity's martial arts training. I've never seen this before, but I have such high expectations for it. I know it's going to be good. But if not, I will be very, very disappointed. We'll save that for the end of the show. But we talk about, obviously, this crazy thing that Trump is doing now. Trump said on Monday that he's going to be taking hydroxychloroquine, an anti-malarial drug, whose effectiveness against the coronavirus is unproven for about a week and a half as a preventive measure, saying he has no symptoms of COVID-19. And honestly, this is like, if it's true, like, which you never know, like, it could very well be completely untrue, false, and just an absolute lie. Like, he's just saying that to make it look good, because it does kind of look almost like, if you're taking it from like some of his biggest fans, for example, the people who had a big boat parade for him 2 weekends now in a row through Central Florida waters to Mar-a-Lago, this is like him putting his money where their mouth is, and really also doing the thing that they love him to do the most, which is own the hell out of the stupid cuck mainstream liberal media. And he's doing that because, like, he's really, what he's doing is he's putting his money, at least, where his mouth is. Like, he's doing the thing, he's taking the drug that they all whined about how it was unsafe, it didn't work, and they were trying to hamper Trump's effort. They were trying to drag this coronavirus crisis out, and now, look at what he's doing. He's taking that drug. What a absolute boss. He's so cool. Like, imagine that. Like, he's the coolest guy ever. So, yeah, like, I'm just taking you a sneak peek inside the mind of a Trump supporter there. But that's what I'm thinking about it. And I guess it kind of does make sense, because he is, I mean, if this is true, which is a big caveat, as always with the White House, if this is true, I think he's actually doing something that is a very, very interesting kind of experiment here, because if this drug does work, because obviously the results, they've been unproven, things have been pretty spotty so far. I definitely would not recommend you go and taking hydroxychloroquine unless it's like specifically prescribed by a doctor, because people actually do need that. Like a family friend of ours, like, relies on that drug for her, like, inflammation in her hand. Like, if it gets below like a certain temperature, she has to wear gloves, or her hand just like swell up in a massive way. And that's obviously awful. Like, you don't want that to happen. So the biggest problem is, like, and if that happens and her hands will start to get inflamed, if people start, like, taking all the drugs out of the shelf. Like, this is just some of the stuff that we have to worry about with this really completely unproven drug. And at least he's doing it. At least he's putting his money where his mouth is. But I think, honestly, it's going to be really interesting to see if something happens. If this is true, I mean, he's putting really only him at risk here, at least for the first time in forever. All I can tell you so far is I seem to be okay, he said, explaining that he takes a daily pill. The FDA issued a safety warning in April about hydroxychloroquine and chloroquine, malaria prevention drugs that have been used to repeatedly promoted by Trump and his administration, and it's been widely used to treat patients despite lack of evidence that it actually works. The drug can cause dangerous abnormalities in heart rhythm in virus patients, the FDA warned, saying that they should be used only in clinical trials or hospitals where patients can be closely monitored for heart problems. So that's something pretty bad, and especially if he continues with this fast food diet that we know he loves, it could be a bad combination. Stephen Nissen, the chief academic officer in the Miller Family Heart, Vascular, and Thoracic Institute at the Cleveland Clinic, said that he had treated patients who developed a life-threatening arrhythmia, which the drug can cause. This disorder can be lethal, says Dr. Nissen. My concern would be the public not hear the comments about the use of hydrochloroquine and believe that taking this drug to prevent COVID-19 infection is without hazards. In fact, there are serious hazards. So just because Trump's taking it, please do not go out and buy it, because you are different than Trump. You're not the president. You're not being highly monitored for any little sign, and you're not going to be able to report any little sign to a team of doctors that's going to be at your every word because you're the president, like trying to do everything for you. So if you're out there, please, again, do not take this. It's a very, very bad thing to do unless you're in a good, unless you're recommended by a doctor and very closely monitored. So that's a pretty important situation. Also, here's what else is going on in coronavirus news. The Trump administration will announce on Tuesday that it has signed a $354 million contract with a newly created company based out of Richmond, Virginia, to manufacture generic medicines and pharmaceutical ingredients that are needed to treat COVID-19, but are made mostly overseas in India and China. The 4-year contract was awarded to Flow Corp by the Biomedical Advanced Research and Development Authority. It messaged Trump's America's first economic push and promises with concerns the coronavirus treatment being manufactured in the United States. And I think it's really, good. I think that's probably one of the biggest things where left-wing populists and right-wing populists agree, is the kind of independence and strength of American manufacturing. The fact that we didn't have a lot of the key stuff that we needed because China had sold it, we had sold all of our key manufacturing and supply chain to China, because it can't always be a global market, interconnected and going at light speed. That's not the perfect world that we live in. It would be nice if that were the utopian scenario, but it's just not the world we live in. We have crises, and sometimes you need to just be able to manage them and do it independently. You can't rely on an outside force. You just cannot do that. It's very, very dangerous, very, very risky. And if you have that force coming, you just don't quite know. That's the kind of probably the more interesting thing. So the 4-year contract, and what I think is also going to be very interesting is what is this company? And we're going to find more about this Flow Corp company. It was associated with someone in the Trump administration, and there was some kind of deal that was passed off. So they make it. Do they do it incompetently? Did they give $300+ million, or $354 million to the wrong person? That's going to be another thing. Why did they giving it? I mean, with this administration and things that they've been able to pull, and I think with any administration, we should know more about this company. And I think you really do have to be very suspicious of everything that Donald Trump does, because of the crazy fact. The fact of life with him is that it is so different, and it's very, very tough to completely keep an eye on everything, but you got to, because things are just going to get pulled away. And I think I've said this before, and I really do believe that once we see the rug kind of pulled out from under this, in this kind of situation, we are just going to see really high amounts of corruption and just graft and Tammany Hall style contract awardings and like stuff like that, just the complete manipulation of government to which is really the complete craziness and the manipulation of government to personal profits. The COVID-19 pandemic has reminded us how health threats or other sources of instability can threaten America's medical supply chain, potentially endangering Americans' health, Trump's Health Secretary Alex Azar said in a statement obtained by Cheryl Gay Stolberg of the New York Times. administration plans to release Tuesday morning. It continued, working with the private sector, HHS is taking a significant step to rebuild our domestic ability to protect ourselves from health threats. It was unclear why the Trump administration decided to award such a large grant to a company incorporated in January when an entire industry, contract manufacturing, already makes drugs for other companies. However, those manufacturers that operate in the United States generally make finished products using raw ingredients imported from elsewhere. They do not make the raw ingredients. So the founder of Flow, Eric Edwards, says that the company, this is of course the company that they're giving the money to, the government is, said the company initially planned to focus on drugs needed by children, but switched gears when the coronavirus pandemic emerged. He said Flow intended to create a stockpile for pharmaceutical ingredients to be used in the event of drug shortages or an emergency, which would be very nice and would kind of help in the best way to kind of prevent like price gouging measures by pharmaceutical companies. Of course, the best thing you can do is to negotiate prices with the pharmaceutical companies, but of course, like that's just way too much to hope for. Like that's way too much. Like we're being way too ambitious to really push for like accountability in government. No way. Like that's just insane, right? Yeah. So speaking of Alex Azar and this Trump administration handling of things, Alex Azar, he's obviously the Secretary of Health and Human Services. Administration, association, whatever, sharply criticized the WHO and really, I think, kind of the very political tact the Trump administration is taking here ahead of the election, which is try to spin as much blame as humanly possible onto China. And I'm not saying that China and the WHO are without it, but I'm saying Trump is going to try and do this, and we shouldn't let him because he has done much worse for this country than China. Like the reason why 90,000 people are dead, China's a part of it, but it's like 10%, 15%. Trump, I think, is much more at fault, and I think it's also a big part of it lies with the big states, like the outbreaks and the people who really failed the worst at containing the curve. And I do think there's something to be said, at least for this argument that New York faced, like typical like toughness with the fact the population is very dense and everything's very close together. It's tough for de Blasio and tough for Cuomo to manage it. But at a certain point, like some of the incompetence and some of the, like a lot of the fact that we have had people dying from this, it's due to a kind of a pissing match between the two. And there's been reporting on this. I think there's going to be a lot of reporting on this from the famously anti-de Blasio, but probably more pro-Cuomo New York press, and we're gonna probably find a lot more about this. Some New York Post articles, a few New York Post articles down the road. I think we will begin to really understand what is exactly the focus here, because we're gonna see a lot more on that, because that is where I think all of the fault lies for the death and destruction, the carnage that we've seen here in the United States of America. It's not with China. It's a lot of it's with Trump. A lot of it's with major local leaders who really screwed up. I think you put Georgia, Texas in this category. Like the rush to reopen there, I think, has already proven catastrophic. Because there has been leaders, for Jay Inslee, he's good on climate policy, did a great job managing this coronavirus crisis as well. So like that's something to be said for him as well. And I think it's something that you got to take into consideration. But you can't blame China. This is ridiculous. So Azar's combative remarks were delivered in a prepared video to the World Health Assembly, the global health agency's annual meeting, and its first during the pandemic, is a significant escalation of the Trump administration's efforts, I think, in a completely political manner to come out and try and blame China for this virus. So here is a taste of this.
Out of control.
Let's rewind, and here's Alex Azar.
About one of the primary reasons this outbreak spun out of control. There was a failure by this organization to obtain the information that the world needed, and that failure cost many lives. The United States welcomes the assistance provided by our friends during this crisis, and we have been proud to allocate over $9 billion that will benefit the global COVID-19 response. WHO's operations must be transparent too, and we support an independent review of every aspect of WHO's response to the pandemic. We all must come together to ensure that WHO fulfills its key mandate,